Clinical Laboratory License Exam. Quality Assessment. By Tarek Hammam. Subscribe, like, and share so that all colleagues may benefit. Question 1. Blood received in the laboratory for blood gas analysis must meet which of the following requirements? 1. On ice, thin fibrin strands only, no air bubbles. 2. On ice, no clots, fewer than 4 air bubbles. 3. On ice, no clots, no air bubbles. 4. Room temperature, no clots, no air bubbles. Correct answer, number 3. On ice, no clots, no air bubbles. Pre-analytical interference with blood gas analysis. Question 2. After a difficult venipuncture requiring prolonged application of the tourniquet, the serum potassium was found to be 6.8 milliequivalents per liter, 6.8 millimoles per liter. The best course of action is to 1. Repeat the test using the same specimen. 2. Adjust the value based on the current serum sodium. 3. Repeat the test using freshly drawn serum. 4. Cancel the test. Correct answer, 3. Repeat the test using freshly drawn serum. Use of tourniquet for over 1 to 3 minutes can cause elevation in protein and albumin, calcium, potassium, and hemoglobin. Question 3. Serum from a patient with metastatic carcinoma of the prostate was separated from the clot and stored at room temperature. The following results were obtained. Patient result. Calcium 10.8 milligrams per deciliter and reference range 8.8 to 10.3. Lactate dehydrogenase 420 units per liter and reference range 50 to 150. Acid phosphatase 0.1 units per liter and reference range 0 to 5.5. The technician should repeat the 1. Lactate dehydrogenase using diluted serum. 2. Acid phosphatase with freshly drawn serum. 3. Lactate dehydrogenase with fresh serum. 4. Repeat tests using plasma. Correct answer, 2. Acid phosphatase with freshly drawn serum. Precautions. Acid phosphatase is unstable at room temperature greater than 37 C. Acid phosphatase is unstable if the pH is greater than 7.0. The serum is separated immediately and the test is performed within 1 hour. EDTA plasma is preferred that stabilizes the acid phosphatase. Avoid prostatic massage in the last 48 hours. Hemolysis falsely raised the value. 50% of activity lost if kept at room temperature. Question 4. A lipemic serum is separated and frozen at -20 degrees centigrade for assay at a later date. 1 week later, prior to performing an assay for triglycerides, the specimen should be 1. Warmed to 37 C and mixed thoroughly. 2. Warmed to 15 and centrifuged. 3. Transferred to a glycerated test tube. 4. Discarded and a new specimen obtained. Correct answer, 1. Warmed to 37 degrees centigrade and mixed thoroughly. Frozen samples should be allowed to thaw slowly at room temperature, or in a 37 degrees centigrade water bath, and should then be mixed thoroughly before analysis. Question 5. In a specimen collected for plasma glucose analysis, what is the function of sodium fluoride? 1. Serves as a coenzyme of hexokinase. 2. Prevents reactivity of non-glucose reducing substances. 3. Precipitates proteins. 4. Inhibits glycolysis. Correct answer, 4. Inhibits glycolysis. Sodium fluoride exerts its preservative action by inhibiting the enzyme systems involved in glycolysis. Question 6. As part of a hyperlipidemia screening program, the following results were obtained on a 25-year-old woman 6 hours after eating. Triglycerides, 260 mg per deciliter, 2.86 millimoles per liter. Cholesterol, 120 mg per deciliter, 3.12 millimoles per liter. Which of the following is the best interpretation of these results? 1. Both results are normal, and not affected by the recent meal. 2. Cholesterol is normal, but triglycerides are elevated, which may be attributed to the recent meal. 3. Both results are elevated, indicating a metabolic problem in addition to the non-fasting state. 4. Both results are below normal despite the recent meal, indicating a metabolic problem. Correct answer, 2. Cholesterol is normal, but triglycerides are elevated, which may be attributed to the recent meal. A high-fat diet increases the serum concentrations of triglycerides. Fasting overnight for 10 to 14 hours is the optimal time for fasting around which to standardize blood collections, including lipids. Question 7. Blood was collected in a serum separator tube on a patient who has been fasting since midnight. The time of collection was 7 a.m. The laboratory test, which should be recollected. 1. Triglycerides. 2. Iron. 3. Lactate dehydrogenase. 4. Sodium. Correct answer, 1. Triglycerides. High-fat diet increases the serum concentrations of triglycerides. Fasting overnight for 10 to 14 hours is the optimal time for fasting around which to standardize blood collections, including lipids. Question 8. Arterial blood that is collected in a heparinized syringe, but exposed to room air would be most consistent with the changes in which of the following specimens? Specimen A, PO2 elevated, PCO2 decreased, pH elevated. Specimen B, PO2 decreased, PCO2 elevated, pH decreased. Specimen C, PO2 unchanged, PCO2 elevated, pH unchanged. Specimen D, PO2 decreased, PCO2 decreased, pH decreased. Correct answer, specimen A, PO2 elevated, PCO2 decreased, pH elevated. The presence or exposure of excess gas, oxygen, in the syringe used to collect blood gas specimens will cause diffusion of carbon dioxide out of the specimen, oxygen into the specimen, and an increase in pH. Question 9. Specimens for blood gas determination should be drawn into a syringe containing 1. No preservative. 2. Heparin. 3. EDTA. 4. Oxalate. Correct answer, 2. Heparin. Arterial specimens are best collected anaerobically with lyophilized heparin anticoagulant in sterile syringes. Question 10. Unless blood gas measurements are made immediately after sampling, in vitro glycolysis of the blood causes a 1. Rise in pH and PCO2. 2. Fall in pH and a rise in PO2. 3. Rise in pH and a fall in PO2. 4. Fall in pH and a rise in PCO2. Correct answer, 4. Fall in pH and a rise in PCO2. Failure to adequately chill blood gas specimens, if not immediately analyzed, will allow glucose metabolism, which increases carbon dioxide and lowers pH. Question 11. Which of the following serum constituents is unstable if a blood specimen is left standing at room temperature for 8 hours before processing? 1. Cholesterol. 2. Triglyceride. 3. Creatinine. 4. Glucose. Correct answer, 4. Glucose. Glucose decreases at a rate of 5% to 7% per hour in whole blood at room temp. Glycolysis will continue until the specimen is processed by centrifugation, and serum and plasma is separated from the cellular components of blood. Question 12. An arterial blood specimen submitted for blood gas analysis was obtained at 8:30 a.m., but was not received in the laboratory until 11 a.m. The technologist should 1. Perform the test immediately upon receipt. 2. Perform the test only if the specimen was submitted in ice water. 3. Request a venous blood specimen. 4. Request a new arterial specimen be obtained. Correct answer, 4. Request a new arterial specimen be obtained. The use of an incorrect tube type, or collection, of a specimen, at an inappropriate time, may also require specimen recollection. Question 13. In monitoring glomerular function, which of the following tests has the highest sensitivity? 1. Urine sodium. 2. BUN, a creatinine ratio. 3. Creatinine clearance. 4. Urea clearance. Correct answer, 3. Creatinine clearance. Creatinine clearance offers the highest sensitivity in monitoring glomerular function of the tests listed.
شكرا للمشاهدة. فضلا وليس أمرا.
Subscribe, like, share,